Namaskar. The second wave of COVID, like I said before, seems to be more deadlier than the first. There are a lot of questions that throws up when you talk about the second wave of COVID. Questions like the second wave, the second strain was supposed to be less deadlier. Then why are we having so much problem? Is lockdown the only solution to break the chain? Is Remdesivir the final answer to all our problem? Are the vaccinations working, and are the vaccination working on these new strains, these new mutated strains of COVID? Are they working? A lot of these questions were popping up, and a lot of you all have also written to us asking us to talk to some experts and get you the opinion. So, which is what I have done this evening. I'm going to talk to Dr. Sangram Patil. Dr. Sangram Patil is a medical expert. He is an ICU expert, phenomenally qualified, works in United Kingdom. He's obviously Indian origin. He's been talking a lot about the latest COVID, the second wave of COVID, and a lot of his what he says made sense. So I requested him if he could join us, and he very graciously agreed to join me on my editorial, and that's the interview that I'm going to share with you. This is what he had to say to all our questions that was asked to him. Let's get right into the show. Doctor, thank you so much for joining us. Thank you so much for sparing time and joining us. Doctor, tell me, is there any difference between the strain, the coronavirus strain in wave 1 and the coronavirus strain in wave 2?
Yes, Sujit, definitely there is a change in strain, as we might have read in Indian media, and it's coming in international media as well, and it has become a concern internationally that the strain in India, which is causing second wave, is different, and it's called double mutant, which just means that two significant mutations have taken place and they're combined together, and it's causing rapid spread and possibly resistance to the existing level of antibodies which people might have accumulated because of the past infections or the vaccines. So there's a possible vaccine resistance as well, but it's not yet clear. Nobody has investigated into it about the vaccines available in India, whether they are responding to these vaccines or not. So the time will tell if somebody investigates about it. But there is a news from Israel that Pfizer BioNTech vaccine is quite effective for Indian strain, the current Indian strain. So this is definitely a different virus, and it's spreading rapidly, and it's not as harmful as it would. It's pictured in Indian media. It's deadly and causing more deaths. It's not like that. It's just spreading rapidly and causing more people to become ill, and that's why we're getting more admissions, and some of them are dying as well.
The kind of panic that we are seeing currently is possibly more than what we saw in wave 1. Why is that so, Doctor?
I think wave 1 had a panic as well, but people felt safe because there was no COVID in the village areas, in the rural areas. Like Bihar did not have COVID, Uttarakhand did not have COVID, so they kind of they were worried, but there were people on the road and people were worried. They didn't die, they didn't get infected, but there was a panic. This time the panic is different because this is a real second large wave, like it was 100 years ago in flu pandemic, Spanish flu pandemic. There was a very big second wave, and it killed most people. Whatever 5 to 10 crore people died all over the world, most of them died during second wave. And this is what is happening now in India. We were feeling proud, our political system and our media, that India has managed very well and we haven't seen deaths. The West is seeing, UK is seeing, or America, Italy is seeing. But now we are seeing that amount of death toll in India, and that though that picture is making people panic more, I think the panic is multifactorial. It's the first and most important thing is that the system is not equipped well to deal with the situation. We haven't got enough oxygenated bed. We haven't got enough ventilated beds. That's one part of it. But the second part is, people are worried more about the information coming from different sources and the politics going on and the cultural and religious and political, rallies and get-togethers happening. The people are getting worried about these all things as well, and this all is impacting people's anxiety levels. These things are not seen in other countries, where the panic is only if I get infection and if I fall sick, will the system be able to save me? That's the only panic they have. But in India, it's just a part of the problem, and there are lots of other things about Remdesivir. I'm not getting Remdesivir, so here in America, people don't have to run after Remdesivir. The system makes it available. The ventilator, oxygen, the system makes it available for them. But whereas in India, the panic is multifactorial.
So one thing you made it very clear. It is not the fact that the virus is deadlier. It is the fact that it has spread more. And since it has spread more people are affected, more people are going to hospitals and more people are dying. So per se, the virus is not deadly. Is that what you're saying, doctor?
At the moment, there is no such data that this virus is killing. There are certain things like infection fatality rate or case fatality ratio, the number of people dying out of people who actually fall sick, or number of people dying from a group of people who get infected. That number is not higher than the previous strains. And that's been actually not just mentioned by Indian experts, but even the international scholars in medical field, they agree to this as well, that this virus is spreading more, is entering the body tissues faster than the previous strains, and is probably slightly resistant to the vaccine as well, but it is not killing more people in comparison to the previous viruses, previous strains.
So, doctor, will our vaccines hold to this new strain? Will it fight this new strain, or we have a problem with our vaccines?
Right now, there is no conclusive evidence, no data. In fact, I haven't heard or read any Indian organization declaring any results like we have read from Israel, and they have said whatever Indian variant patients they have found, they are responding. The Indian virus is responding to Pfizer BioNTech, at least partly, if not completely. So that's a good news. We have Pfizer BioNTech option available, but this type of scientific data hasn't come from any Indian authority. We need that data as soon as we can, so we can change the policy for vaccination, and whichever vaccine is covering that virus, to a larger extent, that needs to be given, that needs to be publicized and made available to Indian population. But what I understand from logical and scientific angle, that whatever protection the existing vaccines will give to Indians, that will be good enough to save lives, to make the severity less, and to reduce the transmission. Though it might be less efficient and it might still make people sick, but the severity will come down. Even if it is 50% efficient, 40% efficient, that will still be protective to some extent. It will be better than having nothing.
And it'll help to get the fatality down.
Yes, it definitely. If the less people fall sick, less people become severely ill, less people become critically ill, your systems won't be overwhelmed, and they'll be will be still able to provide oxygen and ventilation. So we can manage more severe patients who need help, and that will be, at least something is better than having nothing. So we should carry on vaccinating at the moment, but at the same time, we need to have some kind of investigation quickly to find out whether Sputnik 5 is actually protecting against this virus, whether Covaxin is protecting and Covishield, the Oxford vaccine, is protecting. Because from South Africa, we know that South African variant wasn't responsive to Covishield. There was only 10% protection, which is not good. So carrying out such a big exercise for 10% protection is not cost effective, and it's not practically good thing. So if it gives 40, 50, 60% protection against the current virus, that's good enough. But we need that to come from our scientists, our organizations like ICMR, or various state health organizations. They need to conduct a quick review into this.
I am so happy that you're emphasizing the fact of data to fight this disease. It is so important that we have data, and this data is made public. This is something that we all have been talking about, doctor, in India, but somehow that's seems to be not coming through as it should have. But that's a very valid point you made, doctor. Doctor, another point that I have heard you speak before, and I want to know your opinion on, is about this Remdesivir. How important is Remdesivir? Because today Remdesivir in India seems to be the most talked about drug. How important is Remdesivir actually in curing of COVID-19?
Sujit ji, I'll answer this question in two ways. One is a political answer. In India, since COVID began, we have been giving emphasis to some useless, non-important things. Like in the beginning of the pandemic, our important things were Trump visit, and then the government changes in India, and then after that, attacking workers religiously using all the government and media machinery, and then lockdown came with thali and the candles. So we have been giving emphasis to on the wrong stuff. Similar thing is happening now. Remdesivir is antiviral medicine, which was initially tried for Ebola. It didn't work very well. It's a general antiviral, so it works as a general kind of stopping agent to kill and stop virus. But initial studies with Remdesivir suggested some recovery, faster recovery of the patients, but no benefit for preventing deaths or preventing people from going on ventilators or other kind of benefits, just a recovery. But WHO did a solidarity trial. We all know about this. It's the largest trial conducted all over the world in many countries, and this was the trial which employed maximum patients to Remdesivir group, and it showed that there was no benefit at all from Remdesivir in terms of either recovery or saving patient life or saving patient from going on to ventilator or discharging patients earlier than the control group. And WHO has said don't use Remdesivir. National institutes in various countries, they have initially advocated to use Remdesivir in specific patient groups who develop severe pneumonia, who land up in needing oxygen. That's the specific indication. So if you have a severe pneumonia needing oxygen, you can try Remdesivir, but it doesn't save lives. It can help recover the patient. Those who are going to survive will recover a little bit faster. That's the only benefit, but it's not consistent. So overall evidence is against use of Remdesivir. I haven't used Remdesivir in last 4 months for my ICU, and we have removed it as an essential drug from our protocol in UK. And similar thing in various Western countries. And this has been emphasized by various state health organizations of the government, and the central health ministry also has issued a statement recently that it is not a life-saving medicine. But it's still being used there, and still there's a big fuss, big politics going on. You must have seen the politics in Gujarat. There was some Gujarat leader was selling it, giving it free from the party office. In Maharashtra, there is a politics. There's a big politics going on. This is all unnecessary, and we're doing it for the stuff which is proven to be not effective in that situation. So this is, I see a big politics behind these events. This is just to distract people's attention from the main thing, that the second wave has been managed badly, and there is a government machinery which has been responsible for it. So I think we're just trying to distract people from the main issue, and we need to save people. We need to manage this wave properly. We need to make sure we don't get third wave. These are the main things, and not Remdesivir. And even the government should make it clear to the private doctors they are not to issue Remdesivir, prescribe Remdesivir unless patients fit into these criteria, and we should be strict about it.
Doctor, I understand the politics behind Remdesivir, but what I don't understand is why professional doctors, qualified doctors, recommending Remdesivir, prescribing Remdesivir. And mind you, doctor, this, if I understand right, Remdesivir is not a medicine that was just made for COVID. It was made long back, isn't it?
Yeah, it was a medicine tried for Ebola. It failed, and now it was lying there. And suddenly there were a couple of trials which said, "Oh, it can fasten the recovery." And initially, because there was nothing else to treat this patient, many drug approving agencies like FDA, even the Indian agency, they approved it for emergency use authorization. What that means is if the evidence later on comes against the use of this, they will stop using it. And if it continues to be good, then they will continue to use. So depending on this coming, WHO evidence and many other trials, various organizations in the Western world, they have stopped using it. But the Indian organization for health and drug, the Indian Health Ministry didn't do anything about it. And now when there is a big havoc there, where there's a big political scenario created, now Indian Health Ministry has acted. They should have in the beginning made it clear that medicine does not have a good effect and it is not life-saving. The part of the reason many medical people are prescribing it, I can see because I have worked there, that there are not many things we can offer to these patients for COVID patients. So if somebody is mild, moderate, or even severe, not needing oxygen, there's not much we can do. So when the patient is admitted, you have to give them something. The Indian psychology is that you have to treat. If somebody is suffering from something, that means you have to give medicines. So that one psychology, that do something so they don't deteriorate, but they don't realize that that's not the indication for Remdesivir. It's not proven. And there are lots of such things happening. People are prescribing chloroquine, azithromycin, doxycycline, lots of multivitamins, and none of them are shown to be of any use for COVID. This has been happening. Even the postgraduate specialist doctors, when they are sick with COVID, they themselves are taking 10 tablets, even they are just mild or moderately ill. So that's the psychology overall. Second most important thing is there is a Remdesivir injection, which might be about 500, 700 pounds to purchase for the medical stores. And most medical stores are attached to these COVID centers, hospitals. So the doctors are the direct beneficiary from the benefits of the medicine cell. And that's the big driving force. That's why there was a big black marketing and stocking and all that happening. And this somehow, like Kadha and arsenic and all those stuff in first wave, the second wave is about Remdesivir. So it's just a social media havoc, which has created scenario like if you don't give Remdesivir, people will die. So I think these are the reasons that it's been misused, overprescribed, and and the politicians are not helping it either. So if the politician is distributing it from the office in Ahmedabad, people think that this is something which is going to save life. And if you don't get it, our patients will die. So politicians have not helped at all in both waves.
Another very important question. Is lockdown the only solution? Because Maharashtra, I'm told, is going to get into lockdown by this evening, or possibly they'll announce lockdown by this evening. Delhi has already gone into lockdown. Is lockdown the only solution to break the chain?
Lockdown, you might remember, Mr. Rahul Gandhi had said, and I really like that sentence. That's why I keep saying it again and again. He said lockdown is a pause. So it will pause the transmission, but scientifically, it won't even pause. It will just slow down the spread because the virus is already there in the families, and it will keep spreading in families because it spreads through the droplets and, when people cough and sneeze. So just to slow down the transmission so that the health systems can breathe, they can get organized, and governments can get equipped, they can get ready with ventilators and oxygens and more beds, medicines probably. That's the only purpose of lockdown, to get ready so that you can slow down the spread, you can reduce the number of cases, you can reduce the number of patients who get serious so that you can save the patients. Meanwhile, when you do this in current scenario, we have to vaccinate the population on a very, very massive fast scale so that you stop this virus even during this phase. That's what England has done. England Yeah, we had a lockdown here from Christmas till mid-March, so 3 months of lockdown. And at the same time, the government here started vaccinating, and they imported vaccines from all over. And 50% of the population is now vaccinated. Now the lockdown has been eased, and will be going into complete pre-COVID situation, hopefully in May or June, depending on how it goes. So we have to make sure that we are saving people, getting equipped with the system to save people, and doing arrangements for future waves as well. And if that happens, then your lockdown is successful. We didn't see this in first wave. I think we should do this in this wave. Otherwise, this lockdown will be just useless exercise.
You're saying at one end you do the lockdown, and on the other end, like they did in England, you vaccinate people as much as possible. So both put together will ensure that one can curb this infection. That's what you're saying.
Yeah,
Please.
one more thing, if you allow me. During management of this wave, we have to make sure we triage patients. And triage is what is not happening properly everywhere. Uh, I'm not trying to criticize people who are working hard on the ground, but if you see in the private and even in the government COVID centers, you will see people who don't need to be there. They are admitted, they are getting saline and remdesivir, CT scans. First of all, we don't need CT scans for these patients in general. It's being misused just for wrong clinical reasons and for commercial gains. So 90% people can be managed at home. UK has managed COVID patients just on telephone line. I was sick for 3 weeks and I didn't even see a nurse. Forget about doctor. Didn't go to hospital. I was just talking to them on phone, got my test done, sat at home, took paracetamol, ibuprofen, and 3 weeks at home, and then I joined back. This is what India needs to do. Maximum people will be managed at home. They will be supported by telephone or outpatient visits, and those who deteriorate will be admitted. And that is the triaging we need to do: asymptomatic, mild, moderate, home, and severe without oxygen need in the hospital. That then drastically our need for beds will go down. Drastically, the misuse of medicines and over investigations will go down. But this needs a very coordinated system, coordinated efforts.
We our fatality rate in the wave one was fairly decent. I mean, it was we had controlled the fatality rate in India. What did we do right, or was it just act of God?
Yeah, this point, Sujiji, again, this has been very ill understood point. And our media, I have seen even Prime Minister of the country talking that we had the lowest mortality, and various ministers talking about that. But I don't think there was any contribution from these guys. India is a young country. We are a young population, and we uh, basically saved our people by nature. They got saved. Of course, the system also saved seriously ill people, but because the first wave was mild and it wasn't significant, we got up to 97, 98,000 cases, reported cases daily. Now we're getting 200,000 plus. So you can imagine, this is 4 or 5 times more severe wave. So that time people did die. We saw a lot of young people dying, young doctors and nurses dying. But because it was a milder wave, we saw less mortality, and that wave hadn't spread to lots of rural areas. We didn't see rural spread. Now, those people who were not exposed to virus last time, they are now getting exposed in rural areas, and we have a massive spread. So if we say that we were successful in first wave, then can we say we have failed in second wave? So that's not right to say. That the reason we thought we were successful, we look successful, because the wave didn't spread enough to the masses. It didn't go to the villages, and it just stopped because of the lockdown, and people restricted the movements, and probably the environment and the way virus behaves. It comes in waves. The first wave goes, and then after 3-4 months, the second wave goes. So that wave stopped, and we saved our people. I don't think we did anything particularly brilliant to save our people. That is what happened in Pakistan. That is what happened in Sri Lanka, Bangladesh, everywhere in Southeast Asia. The first wave treated us in the similar manner.
So, doctor, did we handle the first wave correctly? And are we handling the second wave correctly as a nation?
I think on certain things we handled first wave correctly. But those, the management strategies hampered, they affected masses to the extent that I won't say it benefited, such as having a national lockdown all over the country, stopping the trains, buses, and everything on one fine evening. That helped to stop the spread, but then it destroyed, millions of people's lives and jobs
Yes,
and their personal lives, and they died on the roads. So, and nobody knows how many of them died, how many of them are mentally suffering now. So that was good that we had that lockdown situation. So that was good thing. But I don't see much better things happening in comparison to Western world, because we are young. We didn't see the deaths. And I'm not saying the Western countries are doing very well either. The America did the same. You know, people were dying, and their president was just roaming around. He was going and campaigning, even abroad. He came to India for campaigning when his
correct.
country was going through the COVID. So uh, that was the first wave. The good thing that happened was it stopped spread altogether because of the strict lockdown. Second wave, we knew it was going to come, but we did not prepare for it at all. In fact, we added fuel, oil, so that the fire could spread everywhere, such as in elections, the village elections, the Vidhan Sabha elections in 5 states, and cultural and religious programs like Kumbh. They were completely unnecessary when we knew that 100 years ago, Spanish flu killed maximum people in India. The most people who died out of those 5 crore were Indians. We knew the second wave was already there in the Western world, and it would come in next 3 to 4 months, but still we didn't stop that spread. We haven't prepared ourselves for enough oxygen, enough ventilated beds. And let me tell you, the people who are dying are the severe ones, who are not getting oxygen in time, who are not getting ventilator care in time. These are the people dying. Rest population, 90% people don't need that kind of treatment. They don't die, they recover on their own. So we needed to prepare for this group of people, and we didn't prepare even during second wave. And we are carrying on with the same political agendas, same administrative laziness, and same media kind of uh, infodemic, same kind of wrong information, non-evidence based information. Coronil came back. It was there in the first wave, it came again in the second wave, but with more strong equipments, health minister and other big ministers sitting next to Ramdev Baba. So we did the same mistakes. Yeah, first wave, prime minister was talking of kada and other stuff openly, where there was no evidence for it. So we went non-evidence based, no preparations on the ground. We helped the virus to spread. We helped this new variant to take shape in India because of the spread. So I think we haven't done good. The world is worried. I'm listening to the Western media, Western experts, and they're very worried about this Kumbh Mela crowds and election campaigns. They are showing prime minister campaigning a mass, gatherings of 100 and 200,000 people, this Kumbh Mela crowd, and they're worried about this new strain and hospitals getting overstretched. So I don't think we have done the work which we should be proud of in second wave.
What would your advice be to a common Indian, doctor?
My advice to everybody is follow Panchasutri. I have been always telling the Panchasutri. First, stay away from people, 2 meters. Don't go into the crowds. Yeah. Don't travel unnecessary. At the workplace, look after yourself. Make sure you hand wash, use face mask, stay away from people. And if you get symptoms, if you think you have got COVID, fever, cough, feeling weak, feeling, loss of smell, loss of taste, then go and get tested. And don't get panic if you come positive. In 90% of cases, you won't need any specific treatment. You will just need paracetamol, ibuprofen like stuff, and advice from a medical team. 10% cases will need to go to hospital. Some of them will need oxygen, but most of them will come home alive and fit. So we don't need to worry about COVID in that respect. So that's my advice to the people. Don't panic. Even if I was sick for 3 weeks, my wife at the same time was ill for 3 weeks, and we didn't panic. We just stayed at home. We got bored because fever coming every day, and we're just waiting for it to settle down. Cough waiting to settle down. Don't worry. Don't over investigate. Don't worry about these medicines, Remdesivir and all that. And if you're not feeling bad enough, don't do these CT scans and other expensive investigations. You just need a minimum simple interventions. So the government of India and your state machinery must have issued guidelines. Stick to them and just be careful. That's my advice to the common thing. And my advice for the system is do proper triaging and stop misuse of the medicines, and manage the resources and concentrate them for severe patients, and leave mild, moderate and asymptomatic patients home. Just manage them, help them on telephones or outpatient basis.
My last question, Doctor. Doctor, how do you see the third wave? Will it be more dangerous or will it be milder? What is your prediction for the third wave?
I'm not very concerned about third wave. The reason is, if you look at the course of Spanish flu that was 100 years ago, 1818, their second wave was more dangerous. And the reasons for second wave being more dangerous and bigger are the same as they are today. Because people thought the first wave was gone, we have won the battle. They started mixing up and they didn't care, the governments didn't care, and because the virus was in the community already, and then people started mixing, that led to a big second wave, and that is what has happened now. But this time, the good thing is that we have better healthcare systems and we have vaccines. So there are various countries in the world like Israel, UK, US, who are getting control over their pandemic altogether. So Israel is, I think they have almost declared COVID-free nation.
Yes.
Similarly, there are countries like Vietnam, New Zealand, and many countries in the world. They have managed this situation very well. And I'm hoping with more vaccine coming up, if in next 2-3 months we can vaccinate 50% of our people and 25 to 30% people getting infected with natural infection, we will have certain level of herd immunity. So third wave will come, but if we vaccinate properly, then it should be milder than the second wave.
Oh, that's good to hear. Doctor, thank you so much. And thank you for talking straight. It was indeed a pleasure talking to you. And really, a lot of myths have been cleared, Doctor. A lot of myths have been cleared. Thank you so much for this time.
Thank you for having me here. Take care. Bye-bye.
Bye-bye.